Vessels of the heart arteries: 1. Arteria coronaria dextra. 2. Arteria coronaria sinistra. They are the first branches of the aorta. Each coronary artery arises from the corresponding right and left sinus of the arteria coronaria dextra, as is from aorta at the level of right sinus, descends BLT infundibulum of RV and auricle of Ra into AV groove, reaches the right border of heart and gives of right marginal branch. Passes over to diaphragmatic certus I, lodged deeply in AV groove, branches to post wall of Ra ARV and some fine branches which accompany the AV bundle on diaphragmatic surface. It reaches the inferior interventricular branch. Ramus interventriculaire posteriors. At junction of medulla inferior 1-3 of groove. This branch penetrates deeply into myocardium. In supplies the post portion of the ventricular septum die past. Walls of rig L ventricles in interventricular grow. RCA gives of a branch which passes in AV groove to the left half of the heart and sends branches supplying blood to the walls of LA and LV. Arteria coronaria sinistra, larger than RCA. Arise from the level of left sinus of aorta, runs to the left behind the root of the pulmonary trunk and then BLTPT and oris of LA. On passing to the left half of the L groove, LCA divides behind PT usually into a branches right-pointing arrow ramus interventricularis anterior, right-pointing arrow ramus circumfleris, ramus interventricularis anterior, continuing of principal trunk and descends in the antenor IV groove to the apex of the heart, arches over it and enters the terminal part of the INF. IV groove penetrates deep into the myocardium, does not reach the IV branch of RCA. Along its course, it sends small branches to the infundibulum and the nearest aras of the walls of the rel ventrices. A longer branch to the ant parts of the ventricular septum and anastomic branches, small trunks ansing from RCA, supplies the apex of the heart with blood completely. Closest to its origin, the IV branch of LCA gives rise to diagonal artery. Ramus circumflex emerges from under the auricle of LA, runs into AV groove to the left border of the heart and then in the post part of the groove onto the diaphragmatic cert of the heart con. Passing over this surface, it sends a large branch supplying the ante-post walls of LV. RLA supplies blood to the walls of greater than pulmonary front, aorta, right-pointing arrow Ra L, atria, right-pointing arrow right ventricle, greater than post wall of LV, atrial Y, ventricular septum. LLA supplies blood to the walls of greater than pulmonary trunk, right-pointing arrow aorta, rel atria, greater than ant walls of re L ventrices, greater than post walls of left ventrite, atrial of ventricular septum. Veins. Most of the veins of the heart, pulmonary except small and ant veins, bring great cardiac vein blood to sinus coronarias. Pulmonary veins: left marginal vein, middle cardiac vein, oblique vein of left atrium, coronary sinus, small cardiac vein, sinus coronarius, greater than, opens into post part of the cavity of Ra B, T, opening for IVC and right AV orifice. Sinus coronarius, continuation of great cardiac vein. On the diaphragmatic surface of the heart. Lies in the left past part of AV groove. Tunica media, small cardiac versus greater than thin layer of muceular bundles of myocardium cover the coronary sinus to form its middle coat. Valvula sinus coronary, opening of coronary sinus into cavity of Ra is bordered by valve of coronary sins. 2/3 small valves present in the sinus itself closer to its opening. Vena cordis magna begins on the ant surface of the apex of the heart. At first, lies in the antenor IV groove next to descending part of LCA. Ascends and fills into AV groove. Passes along lower margin of LA. Left border of heart, runs in diaphragmatic part of AV groove. Continuous with coronary sinus. Receives veins of greater than ant wall of both ventricles, right pointing arrow ventricular septum, greater than posterior vein of left venfrice, vena obliqua auri sinistra, arises on the lateral wall of LA, descends from left to right as a small branch in the pericardium, descends to the right on post wall of left atrium. Conlineous with coronary sinus vena ventricule sinistri posterior begins on posterior's lateral wall of LV, stretches upwards, leading either into great cardiac vein or dictally into the coronary sinus vena cordis media, arises on posterior surface at the apex, passes in the inferior IV groove, ends in the right extremity of coronary sinus, receives small branches from post walls of both ventricles. Middle cardiac vein anastomoses with great cardiac vein at cardial nodon. Vena cordis parva, small, begins on right border of RA and RV, fits into the past part of AV groove. Either enters right extremity of coxinary sinus or independently opens into cavity of RA or sometimes into middle cardiac vein. Vendae cordis anteriores arise in the region of ant and lateral walls of RV, stretch upwards and to the right towards AV groove, enter directly into right atrium. Very small valves are sometimes found in their orifices. Vendae cordis minimae, group of small vessels collecting blood from various parts of the heart. Opening through foramina venerum minimarum. Greater than directly into RA, right pointing arrow, partly into LA, right pointing arrow into ventrides.